test before they give her medicine. Why aren't we drug testing kids during their yearly physicals to do a drug screen? Or at least urging parents, I know Hemphill does give urine screens in middle school for free to families. I'm not sure how many people use them though. I think, as what Kathy said, I think we have to start younger. 9 years of working in the school system, it just shocked me. 11, 12, 10-year-olds using drugs, drinking the Robitussin, drinking the NyQuil, and parents don't have a clue. I get that not my kid syndrome, it makes me crazy. So that's my 2 cents.
That's good. Well, I was saying this, a recommendation that comes from this, I want to make sure we know, and it's so critically important that we cannot get this message out enough. But prescription drugs only get prescribed to you what you need, right? So they come and submit it saying the P's. Always tell the doctor what else you're taking. So this, even adults have this, because a lot of times it's medications in the medicine cabinet. Store them in a secure place, and if someone is coming to visit you in the house, hide them, lock them up if you can. Someone's come to work in your bathroom, they just may peek in your medicine cabinet and grab a bunch. Kids are visiting your house, and the teenagers may come by and see what's in your medicine cabinet and put them in their pocket. And of course, dispose of them properly. Is there a program here in the county where people have drugs, they can dispose of them? Where do they go? There's some state things, Secretary, can you talk about that?
Congressman, thanks for putting on this event.
Thank you.
Healthy Pennsylvania has a program, and we've worked with the District Attorney John Peck to establish 21 prescription drug permanent collection boxes. Under DEA rules, they have to be in police stations, which is smart because they're a little bit of a pot of gold at the end of the rainbow for some people, and they're properly disposed of by law enforcement. So if you have 21 police stations, you're actually tied with Philadelphia for the most permanent collection boxes in the state, in your county, and that's because of your DA, John Peck, working with your County Drug and Alcohol Director, Colleen Hughes. They've done a really, really good job, and what you said is absolutely critical. The days of leaving those in your medicine cabinet for a later day, that's going to kill some kid, and you can't do that anymore.
Right. And of course, it also goes so you don't flush them down the toilet because they find these things in the water system. And efficient centers. Rochelle?
Hi, my name is Rochelle Morelli. I lost my son Jonathan February 6th of last year. He was 18 years old. He died of a heroin overdose. Needless to say, my life has never been the same. But my son's addiction started in 9th grade when he had a rare wrist break. He was actually a case study, so they weren't sure exactly how long pain he was going to be in. And he suffered from depression. My husband committed suicide when my son was in 4th grade. A year later, his best friend was killed. He was hit by a car. Never once did the doctor say to me, does addiction run in your family? Does your son suffer from any kind of mental health issues? Not only do we need to educate our children, we need to educate ourselves. When the doctor handed me the prescription for Vicodin, never did it occur that this would be the path to lead my son to addiction, which then eventually led to heroin, which eventually led to his death. I took him to rehab twice, but had I known what I know now back then, I would have never got that prescription filled. And I didn't know, I was not aware, but we need to be aware. We need to be our kids' best guard. We need to understand what this can do to them. I'm sure my son would have probably have drank, but as far as touching drugs, I don't know if that would have ever happened unless he got that prescription for Vicodin and he realized this numbed my depression. I actually feel normal again. I feel better. And that is what led him to go in search of it more.
He was self-medicating by taking this to deal with his depression. Is there anybody here from an principals, superintendents, teachers? I'd love to hear what schools are doing. I've got a mom here. First, do you want to talk first?
Hi, I'm Brendan's mother, and I'm one of the lucky ones. I'm trying to not get emotional, but I'm here with him. And I think one of the reasons I'm here with him is because I barely let him off my sight. And all I can say is we are in the wild west of addiction. There are no rules. Everyone tells you, you know, tough love, all of that kind of stuff. I don't believe that. I think that, and you know, we've all tried that. Some of us blame ourselves for doing that. I did not. I stuck with him all through everything, as I would have if he had any other type of a disease. And he was clean for 3 years, and he hurt his toe, and a doctor, when he was not living with me, prescribed OxyContin, and he was back on heroin again. And we have to find funding, insurance companies that will cover Vivitrol. He recently only had it covered by his insurance company. We were paying $1,000 a month for years for Vivitrol. But Vivitrol right now is the savior if you have a kid with an opiate problem. I mean, you know, there are no fast answers, but you get them on Vivitrol, it takes all of that out of the equation. So.
Hi, my name is Valerie Pence. I'm a registered nurse and I'm also the mother of a recovering addict, my son Ryan. I did approach our school district. He does have about a year clean now, but it's been 3 years of 5 times in and out of rehab. But we need to educate the parents. Me being a nurse, I'm not an expert in addiction, but I did everything that I could possibly do to keep my kids safe. But at the time, he graduated in 2008, I didn't know that 80% of the world prescription narcotics are written in our country, and we are only 5% of the world's population. It was a candy store for my child. He went to school, it was at the lockers, it was on his hockey team, it was on his baseball team, it was at his college. The only place it wasn't was my home. I could not protect my son. So our country has a problem with the drugs that's exposed my child to that. I cannot hold his hand every second. Now I have to live with this for the rest of our lives because he's not cured, there'll never be a cure. But like this young man said, he could never be a history teacher. Who's going to hire him? And even though that was his love, nobody's going to hire him. The other thing I wanted to say is Gary Tennis, I've never met you, but when I approached our school, I was very surprised to hear the statistics here that the Secretary of Drug and Alcohol Programs in Harrisburg notified every single school district in the state of Pennsylvania about a no-cost drug awareness program that has proven to stem drug abuse by adolescents, providing teachers with specialized training, and only 50 of the 501 school districts signed on to the program, and only 1 in Westmoreland County. So we need to work together from all aspects, and I, as well as Celeste, who also has a son that's a recovering addict, and she's also a nurse, are bringing a program to teach parents and children about the dangers of which I did not know. And kids are going to be kids, and adolescents are going to try things. My kid was not a bad kid. And we need to educate, and I am very disturbed that the schools didn't do that. And I don't even know if it's still an offer.
It's not.
It's not. Very sad.
Pennsylvania Commission on Crime and Delinquency has grant programs for schools to set up life skills training so they can apply to them. But that free offer that came out of Colorado has come and gone, and that was a disappointing.
Colorado, yeah, it's working real well.
Oh, well, they needed it. No, this is actually nothing to do with the state. It just happens to be that's with a nonprofit.
What,
It was called life skills training.
How much does it cost for a school to do it?
I don't know. I think it's a few $1,000 for each school. It's not expensive life skills training, and it's a well documented, well-researched
You know,
program.
what school district in Westmoreland County has it?
We're from the Bell Vernon area.
Is that how, and they, Bell Vernon had it? Or no, what's?
Yeah.
Latrobe had it? Is anybody here from Latrobe School District that knows about that? Are you? You just want to see if anybody knows that.
One of the assistant principals at Greensburg Salem School District. In my previous districts, we did, in Everett School District, have the life skills program. It is a quality program. The problem is, goes back to what you just said. We offered, that program gave us so much money where we offered free food, free dinner, free gas cards for parents to show up. And we had about 800 kids, 600 to 800 kids in our school. We probably had about 8 sessions a year, probably had 10 parents show up.
So you had something?
Might I add to that?
Yes, go ahead. You want to add to that?
You know, just the other day I went, and I'm sorry, I'm not going to work, and we're trying to do some things like Sages on Me. And what we found when I was in Washington last week at a press conference with the corner, just in one county, what we were hearing from some of the schools is that the parents are actually getting their kids out of these programs using excuses. The kids don't want to go, their parents just let them come home. You know, so there is a huge problem. Both of my children are in recovery. I started not one more because I want to save my kids' lives, because I'm still fighting every day. My daughter just relapsed 2 weeks ago for a day, and thank goodness she had the sense to be there with me and stick by my side, but it's constant. We face everything between both of my kids. Thank goodness he's clean for 2 years in Missouri, but I wait every day wondering when it's going to happen, and I'm not there. We have to tackle this problem on the school level. Parents need educated, and we need to also consider some of the programs that we're seeing in the rehabs maybe being introduced to teach kids not just about drugs, but also about what addiction really is. There's a huge misconception, and you have to look at it from a kid's brain. And my daughter was one of the kids that was going to Harrisburg on all these things to prevent drugs, and wouldn't even talk to her friends using pot, and she was a year in college and was on heroin, and nobody could understand it. Okay, and we're talking, we need like CBT, MRT in these schools too. There's things that have to be done, and we just are not going to stand back and take it anymore.
Thank you. I think it's going to take a
Karen, if you just stand up, we'll look for a couple of comments here. I want to go to a couple of people here too. Well, we get just one. I'll be back to you. Okay, we get her. She did a thing.
Hi, I'm Gina Davis, and I am the director of the Norwin site of the Reality Tour. And as the lady just mentioned about educating children in school, and one of the reasons that we hold our program outside of school is because we want the parents to buy into the program. And I know there's quite a few popping up in the area, which is just awesome. I'm fortunate enough to be in the Norwin School District, where we have our superintendent, Bill Kerr, who has just been relentless in our school district to get our goal is to have every family go through Reality Tour. And it is a drug prevention program that starts with age 10. And when I first went to it, I thought, this is crazy for a 10-year-old. And our principal at the time, well, she's still there, said, we have heroin packets in our middle school. And I think we not only need to educate our children and parents, but we need to educate our school administrators, as well as I've had a local magistrate say to me, I don't know why they keep bringing them back. We need to educate people that this is a disease, and these are not bad people doing this. These are good people who maybe made a bad choice, who a doctor prescribed medication that they got addicted to, but not everybody that drinks alcohol and smokes pot ends up an addict. But people with an addictive behavior, addictive disease, do become addicts. And that's what we need to educate across the board. A magistrate that says that to me, why do they keep bringing them, why do the ambulance people keep bringing them back? That's despicable to me.
Are there any emergency room doctors here? No. Come on, stand up. So, from Excel, I guess you see that in the gym, right? So, you see a lot of these things firsthand. Tell us what your experience and your thoughts on this.
Well, it's a couple different things, the way to look at it. We see it from the heroin overdoses coming in. We see it from people coming in faking injuries. We see it from people coming in with big black and blue marks because they drop a cinder block on their arm, and they come in there in obvious pain. They may get 2 days worth of biking in because they have an acute injury. Our electronic medical records help us a lot because it's easy. One click and we can see all the visits through all our emergency departments. We can easily see if somebody's had 15, 20 visits over the last year, and they're all for painful reasons. So it's easy now to start stopping the problem where people start inflicting injuries on themselves or faking injuries in order to get these meds. What a lot of parents may not realize is it starts out with maybe biking, but what happens is people fake injuries. They'll get 20 biking. They'll sell them for $100 to middle school kid. That $100 buys 10 bags of heroin. Why do people go to heroin? It's a lot cheaper to use heroin. It's pretty hard to spend $100 on 20 biking all the time to try to get high, and you can get 10 bags of heroin for it. So our way, we're doing it, and Bill Jenkins, one of my partners, he's the director of FRIC, I'm the chair of the emergency departments at Stella. We've teamed up, and work with the County Drug Task Force, and we're actually instituting some different programs through our departments to try to stop overprescribing and stop prescribing medications, sort of like the information you had for Ohio. We don't have that in Pennsylvania. So it's difficult to actually determine who's telling the truth, who has a painful condition. There are some people that come in that you wouldn't think that they're having a lot of pain because they're stoic. And you look at their MRI and you know that they're having surgery in 2 days and they ran out of pain meds. What do? So you know they're having an acute painful problem. So do you actually give them a prescription or not? I know what our policy is. We're not going to give out any more than 24 to 48 hours worth of medications. And that's for an acute painful injury. And we're not going to be refilling prescriptions, and we don't refill prescriptions. I had a patient last night that came in that wanted methadone, 20 milligrams twice a day. She's here from out of state. She's taking care of her elderly family members. And she ran out of her medicines while she's here, doing this great job for her family, which may be the truth. I told her to come back during the day where we could call her physician's office and collaborate a story, and we'll consider any kind of pain treatment. She wasn't happy. She was worried that her getting discharged. But that's the kind of factors we face in the emergency department.
It's good you're taking a stand. That's important. There's treatment need here too, but you had your hand up there. I'm going to go back over there to a couple of folks who volunteered.
Hi, Amy Daniels. I work for Quest Diagnostics Laboratories, and I'm a prescription drug monitoring specialist. I don't Clark, Ireland. I educate physicians every day, or attempt to, on the importance of monitoring patients that are on these controlled substances, as well as just monitoring how much is going on in their offices. And like your statistics say, really typically specialists, they know what they're doing. They're prescribing appropriately, and most of this is coming from the primary cares. But if you would hear the reasons primary care docs will give you for why they don't monitor these patients, it has to be physician education. They don't monitor them because they don't feel it's their job. And they'll say this to you. It's not their job to police patients. They believe that. They also trust their patients. They don't understand that this problem goes across every socioeconomic boundary. They don't get that. And very surprisingly, one of the reasons they don't like to test patients is when it comes back inconsistent with what they've prescribed. They don't want to dismiss the patient because it's a revenue source for their practice. There's a doc within 10 miles of here that actually told me that. Stop testing because she didn't want to lose patients because it's a revenue source.
My name is Colleen Hughes. Excuse me, I'm recovering from cold. I'm the executive director from the Westmoreland Drug and Alcohol Commission. And I kind of want to piggyback off of what Dr. from the XLAER said. We are partnering with Westmoreland Hospital, our Drug and Alcohol Case Management Unit, and the Westmoreland SCA. In conjunction with the Department of Health, the Overdose Rapid Response Drug Task Force, which is talking about ways that we can help individuals that are surviving overdoses that come into the ER. And what we're going to be doing, and we're going live in March, is we're having what is called a mobile case manager. And the mobile case manager is going to be on call 24/7, that will be able to be in the emergency room especially when an overdose person survives, so that we will be able to have that person have a warm hands-off, meaning we want them to be evaluated immediately and to get them in treatment immediately. This has been a work in progress for almost 1 year now. And again, we have another meeting scheduled tomorrow. We plan on going live, and this is definitely something that we have been very proactive about so that we can get not just survivors of overdose, but for any individual that is presenting in the ER that has a drug and alcohol issue, to get them the help they so desperately need. Thank you.
Thank you.